Hi, I'm Dr. Larry Malerba, and welcome to the All Things Homeopathy Clinical Case Series. Today's case illustrates how emotional trauma can sometimes precipitate serious physical illness. Janet is a 47-year-old woman who was diagnosed with Graves' disease and a thyroid nodule a year and a half prior to consulting me. Graves' disease is a disorder of the thyroid that can be dangerous if left untreated. It usually presents as hyperthyroidism. Common symptoms of an overactive thyroid include insomnia, tremors, heart palpitations, anxiety, and weight loss. Janet was diagnosed by lab test well before serious symptoms had developed. She consented to conventional drug therapy with methimazole, but had to discontinue treatment after 3 months because she couldn't tolerate the side effects. Those side effects included nausea, fatigue, and nightmares. Although her lab values improved with drug therapy, interestingly, she simultaneously developed insomnia and hand tremors, symptoms that are typically associated with hyperthyroidism. After quitting methimazole, most of the side effects disappeared. However, her lab values worsened again. Thyroid-stimulating hormone, or TSH, can be a measure of how well the thyroid is functioning. TSH drops below the normal range when the thyroid is overactive, and it rises above normal when the thyroid is underactive. Janet's TSH was 0.45 when she was originally diagnosed. It rose to 1.05 on drug therapy, and it had dropped down even lower to 0.29 by the time she consulted me. Faced with the remaining options of surgery or radioactive iodine therapy, she wanted to try homeopathy first. Surprisingly, when I first met Janet, she had very few complaints other than the abnormal lab values and some fatigue. Lacking symptomatic clues to prescribe on, I asked about other aspects of her life. It turns out that she was warm-blooded and didn't tolerate heat very well. When asked about her favorite food, she listed the following: sushi, egg sandwiches, brownies, pasta, bread, bagels, cheeseburgers, and chocolate. I asked Janet about her fears. She said she was afraid of losing people close to her, public speaking, and water deeper than her head. I asked her to describe herself to me. She said, "I'm pretty laid back, I'm kind-hearted, I have a few good friends, I put other people before my needs, I'm an animal lover, and I like my alone time." I inquired about potential stressors that may have preceded the onset of her Graves' disease. Janet revealed that her mother, who had Alzheimer's, had died 3 years ago. We were close. She died suddenly in her sleep. But I had already grieved before her death. I come to acceptance more quickly than most people. I get it out and then move on. With this information, I had what I needed. I prescribed 2 doses of Natrum muriaticum and asked her to follow up in 3 weeks. When she returned, she told me the following: "I was constipated for the first 2 days. Then I felt better, more energetic, more focused. I had a couple breakdowns. I was in tears thinking about my mother. I also had a dream about a friend who passed away. I feel lighter. My head isn't foggy anymore." To my amazement, Janet told me that about a week after taking the remedy, her brother called to tell her about a dream he'd had. In the dream, their mother told Janet's brother to tell Janet not to worry. Then Janet announced to me that she wanted to quit her 30-year-old smoking habit. I considered the initial constipation to be a mild version of an aggravation. The rest was all positive, so I prescribed 2 more doses of Natrum Mur 30C. 5 weeks later, she returned to report, "I feel great, back to normal. I don't get tired, my creativity's coming back, I'm getting lots of ideas, it's wonderful." 7 weeks after taking the first dose of Natrum Mur, her TSH had risen from 0.29 to 0.42. Not only that, but an ultrasound of her thyroid showed that her nodule had shrunken from 3.9 to 3.3 millimeters. I repeated the prescription, 2 more doses of Nat Mur 30C. Janet returned 4 weeks later. "I've been feeling great. I quit smoking 2 weeks ago. I've smoked a half pack to a pack a day since I was 14 years old, and I've never lasted this long. I'm amazed." She had no complaints whatsoever. Janet went on to completely recover from her Graves' disease. Now let's talk about the remedy chosen here. Clues in this case that pointed to Natrum muriaticum, or homeopathic sodium chloride, include desire for starchy foods, desire for chocolate, warm-bloodedness, fear of loss, fear of public speaking, and a desire for alone time. However, Natramur is primarily known for its keynote indication of health problems that can be traced back to unresolved grief. And this is exactly what we see in Janet's case. People who can benefit from Natramur tend to be thoughtful, responsible, considerate individuals who, upon experiencing loss, instinctively keep a stiff upper lip and become determined to move past their painful feelings of hurt and grief. Unfortunately, buried grief tends to make its presence known in other ways. If not honored, it can wreak havoc on one's physical or emotional health. It's fair to say that Janet's internalized grief was the true etiology of her Graves' disease. Her choice of the word breakdown is revealing. It implies a weakening of her defenses against the experience of grief, and yet from a homeopathic perspective, it was the very thing that allowed her healing to take place. As her tears came to the surface, her Graves' disease faded into the background. As for her brother's dream, well, that's a fascinating topic for discussion. I suspect that the dream was no coincidence. Prior to the remedy, Janet was too shut down, unable to receive input regarding her profound loss. When the remedy reconnected her to the grieving process, I believe that Janet's mother recognized the opening and took the opportunity to send a message from beyond, reassuring Janet that all was going to be okay. What do you think? Thanks for listening, and please take a moment to click on the subscribe button at the end of this video. That way you'll be sure not to miss the next episode of All Things Homeopathy.